At Miami Designer Smiles, one of the things that we like to help our patients with is temporomandibular joint disorders. TMJ or TMD is unfortunately a very common occurrence. Some patients don't realize that the temporomandibular joint is one bone but two joints, and it needs to be in harmony, and when it is not, it can cause many symptoms for a patient that they don't always connect with their head and neck symptoms with the dentist. Our training as neuromuscular or physiologic dentist allows us to zoom out on a patient and help to connect the dots for a patient who may have headaches, migraines, earaches, vertigo, ringing of the ears, neck pain, shoulder pain. I know it's hard to believe that all of those things are interconnected, but there's 142 muscles in the head and neck area, and they all must work in harmony. I like to think of it as a system. Most dentists are focused on the teeth aspect of the system, and that's how we were initially trained in dental school. But as our training went on, which we went to LVI, the Las Vegas Institute of Advanced Dental Studies, and after hundreds of hours of learning more and more about this topic, we found it fascinating, and we found that we could help our own children and ourselves, our parents, learning more and more about these neuromuscular techniques. And as I said, most dentists are trained about the teeth, but frankly, the teeth is only 1/3 of the system. There's also the muscles, which need to be in harmony, and the joints. As facial development occurs from the time that we're born, there's three things that need to be occurring. One is that you must breathe through your nose. The second is that your lips have to be closed. And the third is that the tongue has to be on the palate. There's many things that disrupts this genetic code, and modern man has paid a price for being modern. We are sometimes not breastfed as we were intended to be. Also, the development of baby food that was too mushy or soft. There's a great book by an anthropologist called Jaws, The Story of a Hidden Epidemic. He very well, with diagrams and pictures, does a great job of explaining how prehistoric man should have developed and the things that we've given up in our modern world, and not breastfeeding and soft food, placing our babies into extra saucers that don't encourage the natural crawling response, the pollution and things that are happening in our environment are also negative. The rise of allergens, the consumption of cow's milk, all of those things which seem insignificant and very common for ourselves as modern people have caused us a compromise, and our jaws are getting smaller. As the jaws are getting smaller, that means that we have less tongue room. Most people cannot fit their wisdom teeth, and oftentimes it's to a point that when the person goes to the orthodontist, they oftentimes have crowded teeth, and sometimes they're recommended to remove teeth. Unfortunately, that is not a good thing, and it is anti-physiology. Our tongue needs sufficient room and development so that our airway is nice and clear, and our mouth is the front aspect of our airway. So all of these things affect our joint and can cause a disruption. Many times patients feel like their clicking or popping joints is something that doesn't necessarily bother them, but they don't realize that it's a system that over time will continue to deteriorate. Sometimes it takes 5 years and sometimes it takes 10 years, but over time it's causing a breakdown in their temporomandibular joint areas. The patients who suffer from temporomandibular joint disorder sometimes also have an increase in anxiety and depression, because our body has to process all of the pain that is occurring in a patient with chronic pain. At Miami Designer Smiles, we take an approach where we're able to evaluate a patient's muscles and help them to find a bite that their muscles are in harmony, their joint is in harmony, and their teeth could function properly for the rest of their life. And this multifactorial approach of looking at airway, tongue posture, and teeth and muscle position is something that is very important to strive for the harmony in that whole system so that the patient can feel whole again.